Afternoon, everybody. Pnawn da. We'll just give it another minute now because I think people are still coming across, and then we'll make a start. Okay, we'll let people continue to join us. So, Pnawn da. My name is Jo Williams. I'm the Welsh Sexual Assault Services Programme Director. And I'm here today to give you an overview of sexual assault services in Wales and their pathways and support. So originally this session was billed as having two of our paediatric colleagues, but unfortunately they haven't been able to make it today. So I will be presenting by myself and just giving you an overview of where we are with the sexual assault services programme. So let me just make a start. So just as an introduction and welcome, there are a number of lots of people here today, and obviously from lots of different organisations. This is just a request really to make sure that you are looking after yourself as part of this presentation. It is an emotive subject, and if you do need to leave at any point, please do. If you need to contact anybody to speak to somebody after or during this presentation about the issues that are raised, again, please make sure that you contact, either get in touch through the website, which is the Executive NHS Wales, where you'll find contact details of sexual assault referral centres online, and also there's the Live Fear Free helpline, and the number is displayed there. So I shall make a start. Okay. So I thought I'd start the session with just giving a little bit of information on the prevalence of sexual assault across the UK. So so this has come from and I can't remember the apologies, I can't remember the document that this has come from now. But it's a very recent document, and I'll make sure that it's included when we circulate the presentation. That 1 in 4 women have been raped or sexually assaulted as an adult. 1 in 6 children have been sexually abused. 1 in 20 men have been raped or sexually assaulted as an adult. 1 in 35 women are raped every year, and that was by the at the end of March 2020. And 1 in 2 adult survivors of rape have experienced it more than once. So that's just providing a little bit of context in regards to the prevalence of sexual assault in our society today. So moving on to what is a sexual assault referral centre. Now, there are a number of you here on the call today that know what a sexual assault referral centre is, but in regards to what it looks like, the services look like in Wales, there are 8 SARCs, or sexual assault referral centres, across Wales. These are open to everyone of all ages, genders, social backgrounds, ethnic backgrounds, religions, beliefs, disabilities, sexual orientations, basically everybody who has been raped, sexually assaulted, or abused. The SARCs are confidential. However, staff do have a legal duty to share information with the police or social services if a child, young person, or vulnerable adult is considered to be at risk of significant harm. You don't have to speak to the police or a doctor to get help from a SARC. You can access a SARC yourself through self-referral. And your rape, sexual assault, or abuse does not have to be recent for you to get and access the support that you need. If you do decide later that you want to report what happened to you to the police, the staff at the SAR can support you through the process. But, you know, and I think that the key take home from this is that you were in control, that the victim survivor is in control. And again, you can get more information from our website. So just to give a little bit of a visual and animation of what happens within the SARC, we have produced an animation that unfortunately doesn't let me play it. So Andy's going to take over and play the video for you, just for you to that explains better than I can how what support is available through the sexual assault referral centres. And this video will be available after. So I will hopefully pass over to Andy now, who will share the video. I don't think the sound is playing, Andy. Andy, can you hear? Sorry. You might have to listen to it or not listen to it with subtitles. Apologies, everyone. I know that the sound hasn't worked for that. It did work earlier, but I think we're having some technical difficulties today because I've been told that my slides weren't scrolling through either. So we're going to try again and make sure that you can see everything. And we will share a link for the slides so that you can hear it as well, and the animation. Okay, so moving on. So what are we doing as the Welsh Sexual Assault Services Programme? So the Welsh Sexual Assault Services Programme is a service transformation programme. The programme has been around, well, it was first formed quite a while ago, actually, probably back in about 2013-14 after a review from Welsh Government into sexual assault referral centres across Wales. As a result of this review, it was decided that there would be a different model proposed for the way that SARCs were delivered across South Wales. In North Wales, it was the Sexual Assault Referral Centre was at the time working coterminously between North Wales Police and Betty, and it wasn't felt it was functioning really well, and it wasn't felt that it needed to be part of the service transformation that was needed in South Wales. So the Welsh Sexual Assault Services Programme was born and developed, and the ambition for the programme is to deliver a patient and victim centred sexual assault services that's got a trauma-informed approach and health needs as a priority. And the key aim is for us to provide the best outcomes for victims of sexual violence. So in South Wales, it was decided that we would take forward a hub and spoke model for service delivery, for the delivery of sexual assault referral centres. I'll tell you a little bit more about what a hub and spoke model is a little bit later in the presentation. But the aim of this model was to provide a more integrated service that would then support the services, the provision of sexual assault services to meet clinical, forensic, quality and safety standards. And that would really importantly ensure that there were robust governance arrangements. Now, as I said, North Wales wasn't included in the programme initially. So the programme, the hub and spoke model was put forward and agreed as the way forward for SARCs in 2019. There was a little bit of a pause in the programme because the then programme director left, and unfortunately COVID hit. So the programme was started up again in 2021. Where I came to join the programme, and it was decided at that time we needed to have a look at the structures, the governance arrangements, and what we were doing across the entirety of Wales to ensure that when we were looking at models and provision for victims and survivors, that people who needed to access the services would be able to get similar services right the way across Wales. So it was in 2021 that North Wales was also added onto the programme, and that we would work with them to provide the services across North Wales as well, from this SARC in Colwyn Bay. So the programme board, it is quite a complicated programme board. There's a lot of key partners in there because SARC is multi-agency service, so it isn't, it doesn't come under the remit of just one organisation or sector. So the programme board is comprised of health boards, police forces, police and crime commissioners, Welsh Government and third sector NGO organisations as well. As I said, the programme governance is a bit complicated. So we have an overarching programme board that provides reports up into 3 different organisations. So Police in Wales, which is the Police and Crime Commissioners and the Chiefs in Police. The NHS Joint Committee, which is the Chief Execs in Health. And we also provide reports up into Welsh Government, and that also goes to 2 different ministers because we fall under health and social justice. We also have underneath us, underneath the programme board, a number of additional groups. So we have a service engagement group and external service survivor networks and groups. So we don't have our own survivor group, but we engage with existing survivor groups in order to ensure we've got a survivor lens on all the services that we're looking to plan and deliver. Underneath the programme board as well, we have a finance group, an ISO accreditation group, 3 regional delivery groups, and also a group through Traumatic Stress Wales that we work really closely with in order to look at the way that we need to deliver sexual assault services in a trauma-informed way. So what are hub and spokes? It was decided that the model would have centralised hubs and spokes that would provide more local support for victims and survivors. So a hub is a facility that's dedicated to that immediate care for victims. So these will be the sites that offer acute forensic medical examinations, health needs assessments, and referral pathways to provide follow-up care. There's going to be 3 hubs across South Wales. There's one in Aberystwyth, which is currently Bow Street, but which we're looking to develop a new hub in Aberystwyth. There's one in Cardiff, and there's one in Swansea as well. The Cardiff and Swansea hubs will also be hubs for children. The Aberystwyth hub will be an adult-only hub. The spokes then will be providing immediate and ongoing care, but they won't be providing the forensic medical examinations. So the forensic medical examinations are only provided within a certain window of time. And if there are victims that present outside of this window, this forensic window, they aren't, unfortunately, necessarily able to access forensic medical examinations. The spokes then will also provide support for victims who go down the criminal justice route through independent sexual violence advisors. And they will provide counselling support as well. The hubs will also be spokes. So the hubs in Aberystwyth, Swansea and Cardiff will also provide the ISVAs and the counselling support. But the additional centres are and will be in Aberystwyth, which is hub and spoke, Carmarthen and Newtown. In Southeast Wales, there is obviously Cardiff, and then there's Risca and Merthyr. And in Southwest Wales, there will be Swansea. So those are the hubs and the spokes across Wales. When we've come to rolling out the new model, it has been staged across three phases. Phase 1 is where we are kind of in between phase 1 and phase 2 at the moment, but I'll explain that a bit more now. So phase 1 focuses on the implementation of the SARC hubs for children and adults, and the establishment of a Welsh Sexual Assault Services network and commissioning framework. So at the moment, the implementation of the hubs is underway. We are working towards ISO accreditation, which is a new accreditation for SARCs across the UK. That's looking to bring in a standardised model and accreditation for the delivery of sexual assault services that need forensic medical examination. We have now moved across the services, the medical examinations from Merthyr to Cardiff, and we have moved across some of the acute examinations from Risca to also to Cardiff, The in-hours examinations only have gone across at the moment, and we are looking at moving across the out-of-hours examinations within the next couple of months. So as we're implementing phase 1, phase 2 naturally falls out of it. In South West Wales, we are working towards a bit of a longer timeline, but that's due to works that are ongoing in Swansea that are establishing the second paediatric hub, which I will come on to shortly. So we are working our way through phase 1 and phase 2. We are hopeful that these 2 phases will be complete definitely by April 2025. Phase 3 then is looking at the implementation of forensic medical examiners. So we are working closely with the police and Welsh Government around the implementation of forensic medical examiners. This work is ongoing and is slightly more complicated because of devolved legislation, but we are working our way through it. So moving on to the paediatric hub. So currently in South Wales, there is all of the children's examinations take place in Cardiff. It's been this way for a number of years. So these are acute examinations. So these are where the children need to be examined acutely. As part of the model, it was agreed that we would develop a second paediatric hub, and that would be in Swansea. So there's been a lot of work ongoing with Swansea Bay Health Board and New Pathways to develop a site that will not only have the acute examinations, but also historic examinations that are child-friendly. And this is being worked through at the moment with the paediatric team. So the acute examinations obviously need to have been through the accreditation and needs to be ISO accredited. So we are working our way through that at the moment. The funding has been approved by Welsh Government for the required building works in Swansea. So that is also underway and is taken and will hopefully be completed now by the end of March. And we have plans in place to start providing the paediatric clinics, but this will be incremental. So we will be starting off with a few clinics, and then we will be building on that over time. So we will be working our way again towards the full implementation. In regards to the key activities for the programme, so there are a number of key areas that we're working on at the moment. As you've probably heard me mention, the ISO accreditation a couple of times. So we are a Pathfinder site in the Swansea site in Wales is a Pathfinder site, and that basically means that we're one of the first in the country that's looking to go through the accreditation process. We have had an initial inspection. There have been a number of recommendations that have come out of that, and we are working now towards the full accreditation, and hopefully this will be achieved by the end of the year. But we are working closely with UCAS, who's the accreditation body, in order to ensure that we have fully accredited sites. It is a brand new accreditation, so there are some glitches and some hiccups along the way because it's new for everybody. But we are working really closely with them to ensure that we have one of the first sites accredited in the country. The implementation of the hub and spoke model, as I've just outlined. So the hub and spoke model is ongoing, and we're hopeful that by the end of the summer that we will have rolled out the hub and spoke model, and that's subject to the recruitment and the completion of all the required works that need to be done. Paediatric services, we're working really closely, as I've just said, and really to get really closely with Swansea Bay and New Pathways in order to roll out the paediatric service model, and we will hopefully get that completed, the building works completed by the end of March. the commissioning framework. So this is something that we have been putting a lot of effort into, and one of the key functions of the programme. So as I've explained, the programme is a joint programme between police and health. And as part of that, we are developing a commissioning framework, which will, a joint commissioning framework, which is one of the first times it's been done and attempted. We have a number of meetings that are going through the provision and what needs to be included in the commissioning framework. And there have been a number of activities, some of which hopefully that you'll have been engaged in, that we've run, including 4 workshops towards the end of last year, which were for service providers. And we've also been engaging with service users to inform the commissioning framework, and to make sure that we're covering everything that everybody wants. So the commissioning framework isn't going to be a you must do this in this way. There is going to be a number of high-level objectives, and it is going to be down to individual providers how they deliver the services, but the same standards will be expected and required right the way throughout Wales. Performance and data. We have been collecting performance information and have managed to collate 5 years of historical information on performance across the SARCs, and information across the SARCs. We are working on how we can give a more accurate picture of what's going on across Wales in regards to performance data. So we're hoping that as the commissioning framework rolls out, and that we're getting more information on what we think we need to plan and deliver services, this information will become more rich, and we'll be able to share accurate information on how services are performing across Wales, and what they're delivering, and what we need to be looking at in regards to future service planning and delivery. So as I mentioned earlier, Traumatic Stress Wales is a programme that's got a number of substreams, one of which is sexual assault. So I chair the sexual assault work stream within Traumatic Stress Wales, and we've been working together to develop a review of counselling services across Wales. This review has been slightly delayed, but the questionnaire has now been agreed and will be coming out, and hopefully some of you, most of you will receive the questionnaire, and we are going to be making sure that we're mapping and looking at what services are provided in regards to counselling services for survivors of sexual assault and abuse, and we'll be looking to how we plan the counselling and what's needed across Wales once we receive all that information. And one of the biggest things that we also make sure that we try and do is awareness raising. So as you saw and didn't hear, unfortunately, our animation earlier, we are working really closely with our comms partners and partners in England and across the UK to make sure that we're involved and engaging and leading on some of the awareness raising campaigns that are going on, to ensure that there is awareness of sexual assault services, that the stigma is reduced as much as we possibly can, and that people who need help, no matter when, where, how, where in their journey they are, they can access help and support, and that they know that they can access help and support when they need it. So that is my presentation. So it's a bit shorter because it was going to be shared with others, but it does give us more of an opportunity to ask questions. And I know that there have been a number of questions highlighted. So I will stop sharing my screen now. And I know that there's some questions in the chat. So let me just go over to that. And if you have any questions, if you want to pop them into the chat, and I'll try and work my way through them, because I think there's quite a few of us here today. Yeah, 234. So hands might be a little bit tricky. So if you wouldn't mind just popping them in the chat, and I'll try and get through all the questions. Okay, so the first one is from Victoria, who asks, what is an ISO accreditation? So an ISO accreditation is a forensic standard for sexual assault referral centres, and it's only for the ones that actually do the forensic medical examinations. It's an accreditation. That's run by a body called WSAS, which is the UK Accreditation Services, and it's something that's already within a number of services, such as in labs, within health, and within labs, outside of health. But it is a nationally known accreditation. Okay, Elena, if you can't get to a SARC, can a local hospital medical centre provide any support? Just thinking for more isolated areas. So we are looking at how people can access SARCs. There, you can always, anybody can always access their local healthcare providers if they need to. The likelihood is they would be signposted, but it does depend again on where they are in their journey. If it's an acute assault, then they may be provided with transport or helped with transport to get to where they need to. If there is a medical issue, that would have to be managed prior to transport to any sexual assault referral centre. But there are other ways that survivors or victims can contact help if they need to. There is the Live Fear Free helpline. There are also contact telephone numbers for the SARCs in their areas, so they are able to contact people if they aren't able to physically go to a SARC, or if they choose not to attend a hospital or potentially a GP practice. Are there any SARC hubs and spokes up the north? So North Wales has a slightly different model to South Wales. So there is one SARC in North Wales, apologies, that's based in Colwyn Bay, and this is a hub and a spoke. Well, it is a hub and spoke, but it is a hub. There in North Wales, there are also additional other organisations such as WSAS and Stepping Stones that provide counselling support for survivors that need to access services in North Wales. What is the timescale for the new hub and spoke system to phase 3? So for phase 3 of the hub and spoke model, that one we've got a number of timescales, if I'm honest, because we're working towards we're looking at exactly what we need to do in relation to the forensic medical examiners. So if it is that we need to go down a legislative change route, I'm not sure how long that will take. So we are working with Welsh Government at the moment to establish exactly what route we need to take in regards to the forensic medical examiners element of the programme. And we will be sharing updates as soon as we're clear on the way forward and how long that will take. So there is one about the accreditation qualifications that future FMEs will need. I might pass that over. I think I saw Claire Lepet's pop on to the call. Is that right, Claire? Are you there? Oh, yes. I was just wondering if you can help with this one. There's a question. Can you advise on what accreditation qualifications future FMEs will need? Sorry, Claire is one of our clinical leads. I'm not sure. No.
She can't unmute. Let's just see if we
there
can
you
do it
are.
for
I
her.
can hear you.
It's Anna. Hold on.
Oh, Anna. Okay, Claire can't unmute. Okay, we'll pop that one in the chat then. Once we can get that answer. I know that there are FFLM qualifications that are currently.
Hi, Jo.
Oh, yeah. Oh, hi, Claire.
I think Anna or Andy's pressed the magic button. Yeah, in terms of qualifications, we follow the FFLM, that's the Faculty Forensic and Legal Medicine guidance. And they also have guidance for non-medics who are able to do the forensic work in other areas. So there are formal qualifications and courses that are recognised by the faculty, and they're all available. There is a recommendation, workforce recommendation, that a number of FMEs should have a specific qualification, but it's all related to CPD rules, that's continuing professional development. And there is an assumption that providers, so at the moment that's non-NHS providers, but providers would provide training to their staff forensically to keep them updated. If you're self-employed, then that becomes part of your own responsibility to do that.
Thanks, Claire. Okay. Another question. The SACs within Wales from E. Penston. The SACs within Wales, are they always open, or do they change their opening days, times, etc.? So the SAC hubs will be open 24/7 for the forensic medical examinations. Currently, if you do need to access a SAC, they are available 24/7, but for the forensic medical examinations, if it isn't an acute need, then it will likely be signposting that you would receive when you call. But there is a call line that you are able to call, and people that will be able to provide you with advice on what the next steps are if it isn't a forensic medical examination that's needed. Okay, Bethan Watkins, how long can it take from the attendance of a SAC to a final decision if police are involved, and what support can a young person receive during this time? Unfortunately, Bethan, that is a bit of a how long is a piece of string question, I'm afraid. It depends on the path that the person, or young person in this case, goes down. We have, there's a number of organisations that are involved in sexual assault referral cases, sexual assault cases, and it does depend on not only the attendance at SAC, which is the start of it, but also engagement with the police, and then onto the CPS then, and going through the criminal justice system. So unfortunately there isn't a set time scale for a final outcome. But in regards to support, there are both ISVAs and so on the initial contact, there will be a crisis worker who would support the young person initially. Then there will also be ISVAs, which are the independent sexual violence advisors, who would be there right the way through until the conclusion of the criminal case, if that's the decision to go down that route. There are also counselling services that are available that will be there to help support a young person during the entirety of the process. So yeah, so that's that one. Emma Smith, in regards to referrals for children, who can take responsibility in taking the child to the SAC if the child has expressed concerns to teachers? Thank you. When it comes to children, there are safeguarding, obviously safeguarding issues that need to be adhered, safeguarding guidelines that need to be adhered to. So I think that is a bit more of a complicated one, and I'm not sure if I can hand that one over to Sian. Sorry, is that Sian? Anna, can you unmute Sian, please? No.
Can you hear me? I'm trying to unmute Sian.
Yeah, we're trying to unmute Sian. Hang on. Sorry, Sian. We'll try and unmute you now. Joys of new teams.
Sian, can you please try now? No?
Make you a presenter and see if that works. Can you talk now, Sian?
Yeah, but well done. Thank you. Sorry, my I was thinking, I was pressing. I'm really sorry. Sorry, I'm Shano and I'm a community paediatrician that works up in North Wales. I think Claire, actually, to be fair, has probably just put something in the chat. But you're right, absolutely right, Joanna. It's much more, well, it's very different when it comes to certainly younger children. And as you're aware, yeah, I mean, it wouldn't be children. We wouldn't be expecting, children to be certainly not referred by police or sorry, not by schools or anything like that. This would be invariably done via a safeguarding process. So yeah, it's really, really important that this isn't this is an add-on, isn't it, to say to the rest of our safeguarding work, really. So I think Claire has answered the question, hopefully, to Emma's satisfaction. In my experience, it's usually almost invariably family that accompany children to the SARC, except where maybe there is specific, maybe the child's in care, in which case it might well be sort of a social worker or somebody like that accompanying them. But yeah, they need a supportive adult with them, and by and large that's either going to be a parent or somebody very close to them, and in addition to the safeguarding things having been taken care of as well. Yeah, I hope that is helpful.
That's really helpful. Thank you so much, Sian. Okay, and another question from Millie Steele. When the phases are complete, which SARCs will be hubs and which will be spokes? So the hubs will be in Swansea, Cardiff and Aberystwyth. The spokes will be in Merthyr, Risca, Newtown and Carmarthen. But just to make things a little bit more complicated, the hubs will also offer the same services as the spokes. So they'll be kind of a one-stop shop, which will provide the acute and the follow-on care, whereas the dedicated spokes won't provide any forensic medical examination services. They will just be providing the ongoing support in the form of counselling, ISVAs, and crisis workers. So that, I think, comes to the end of the questions. Oh, Millie, is there this information written down everywhere? You're welcome. Yes, so it's on our website. So we will share a link for our website, and we'll also be sharing the presentation and a recording of this session as well. The spokes are based, Babs, in Merthyr, Risca, Newtown and Carmarthen. So those are the 4 dedicated spokes. Okay, thank you. So if there are no more questions, oh, okay. The spokes also have ABE suites for adults and children. Yeah, that's from Lindsay. We will send all the links. We'll send a copy of this and we will, oh, I think Andy's just posted it, all lovely. And thank you again. Apologies for the technical issues that we've had today. If you do want to get in touch with us, we have posted all of the information in the chat, and it'll also be on the end of the slide. If you want to get in touch with us, please get in touch with us. This is an ongoing piece of work, and we want to make sure that we're engaging with as many people as we possibly can, because we do want to get this right. It is a developmental, it is a program that's developing, so we just want to make sure that we're providing the best services for everybody who needs to access them. So thank you all again. Diolch yn fawr, and we shall we put another lunch and learning as the program develops to provide another update. So thank you all.